Over the last 24 hours, we have identified 1,429 new cases of COVID-19 and completed about 15,000 tests. Our positivity rate currently stands at 9.4%. There are now active alerts or outbreaks in 414 schools, which represents 17% of all schools in the province. There are now 340 people in hospital being treated for COVID-19, including 83 in the ICU. Sadly, 3 new deaths were reported to Alberta Health in the last 24 hours. We have identified 717 additional cases of variants of concern in the last 24 hours. Variants currently represent about 45% of our active cases. I know that many Albertans feel information overload about variants, and others have many questions like how contagious variants are, whether vaccines will work, and what we can do to limit onward transmission. To date, 3 variant strains have been detected in Alberta that have us concerned. The B.1.1.7 variant, first reported in the UK, the B.1.351 variant, first reported in South Africa, and the P.1 variant, first identified in Brazil. These variants are still new, but what we know from current evidence is that these 3 variants of concern are more transmissible than the earlier form of the virus. The B.1.1.7 seems to be about 50% more transmissible, and P.1 seems to be closer to twice as infectious. Each of these variants of concern also have some unique properties. The B.1.1.7 variant seems to be able to cause more severe illness than our original strain. At this point, it's not clear if the other 2 variants also have increased severity, or if some of the severe outcomes being reported in countries where they are the dominant strain are due to the high burden of disease because of how infectious they are. One of the biggest questions is how well our vaccines protect against these new variants of concern. The good news is that all 3 vaccines we currently have available are effective at stopping the variant that's most common in Alberta, the B.1.1.7. Evidence is less clear right now about the other 2. Vaccines seem to have a somewhat lower effectiveness against infection with B.1.351 variant, although they still may provide protection against severe outcomes. For P.1, evidence is mixed, and it isn't clear whether there will be a vaccine effectiveness impact. Our knowledge and understanding is rapidly evolving, and we'll know a lot more in the time to come. That's one reason we're keeping measures in place right now, even for people who have gotten a vaccine. We have now reached the point that if you test positive, you should assume that you have the UK variant. Because of this, we are now focusing the efforts of our specialized variant contact tracing team on the P.1 and B.1.351 variants, and we will be treating cases and contacts of B.1.1.7 and the original COVID strain the same going forward. With that in mind, effective today, we will begin offering testing twice to close contacts of all confirmed cases, regardless of what kind of COVID strain they may have been exposed to. We are having ongoing conversations with colleagues on the front line with respect to the response to what we will see in the coming days and weeks. What I would say to those individuals who are planning on defying the public health orders, or those patrons who may attend at those locations, I would ask them to consider our current situation. It's important to remember that, for example, in the 2009 influenza pandemic, the height of our ICU occupancy for influenza H1N1 in 2009, which was a novel influenza, was 35 cases in ICU at any given time. We now have over 80 people in our ICUs, and the numbers will continue to rise as our case count rises. This is something that is extraordinary, and we need everyone to pull together in order to turn the tide and in order to save our healthcare system, to protect our fellow citizens or those in our communities, not just from COVID-19, but also to make sure that healthcare capacity is there for those who need it for any cause.